We are darn close to $1 out of every $5 spent in the United States is related to healthcare. And at some point, our country is in the midst of saying, at what point are you going to let healthcare crowd out every other thing? So just for round numbers, our economy is in the $15 trillion category, and we're getting darn close to $3 trillion of that is spent in the healthcare industry. Yes, we do believe that. Information does have the ability to transform medicine, and the question is whether we in healthcare can actually take this massive data and actually get it to something that's clinically useful. So there might be data that shows Mrs. Smith has a high blood pressure reading. At some point, that's got to translate into some information that there's been enough of those readings to say she actually has hypertension, she has high blood pressure. At some point, that information has to be collected across a lot of members to say, here's the best ways to treat blood pressure, high blood pressure, with medicines, diet, activity, et cetera. And then at some point, that information has to all come together at the level of the healthcare team to be clinically useful. It is one piece of the puzzle. If you do not address this from a process improvement, if you are still delivering care the same way, basically, and just trying to digitize already your flawed processes. I'm looking in the mirror here. My flawed processes, you are really not you're just layering on a lot of cost. And that's why we love this. This is one of our favorite slogans. I don't know if you've seen this. Old organization plus new technology equals costly old organization. Absolutely. And when you do initially get into this world, it slows you down. It slows you down. We had to do a lot of adjustments when we first went up with our HIT system because it took a while. But you do have to at some point do it. This is complex, and you need to think across the whole continuum of care. You need to think across all the team, not just the doctor. How's everybody using this? You need to do it in the context of patient-centered care. I mean, what we have tried to do is try to put everything in that clinician-patient encounter. When the patient was coming in, they're coming in with their complaint. I'm dizzy, I'm lightheaded, my back hurts, or whatever. And by the way, I'm also supposed to be thinking about their prevention gaps and their health maintenance and other issues that are ongoing. And what this shows you, this is just the beginning of all the places that IT could potentially impact the whole care spectrum. You can see everything from appointment reminders that actually may go to the patient. You can actually see when the patient checks in, your medical assistant could actually be doing some smoking assessment and offering smoking cessation materials. Then you see all the tools that the doctor might actually use. And then even after, you can see after visit summaries that you might actually be giving to the patient. And then once the patient has left, they're in the pharmacy in their lab, they're utilizing the same system. And then that same system is being accessed by the patient themselves later. Our current system is not limited to just a clinical tool. It's something that's member access. It's supposed to enhance quality, obviously, and it's also supposed to be a tool for continuous quality improvement. It's like here's a panel support tool that somebody in practice might have that they could actually do on a search. They could look at all their diabetic patients and see who's been in lately, for example, and who has not been, who's not meeting certain, whether it's foot screening or their A1Cs or eye visits, et cetera. My Health Manager is a component of our HIT system where patients actually become a registered member, and so they actually can go on and look at their information. And you can see this was just in 2012. Now this was across our whole system that you saw over 4 million registered user, 13 million secure emails, prescriptions, lab test is huge. In Colorado, just specifically in 2012, about 250,000 people who are registered users, but more importantly, this is how many average sign-ons in a year per member. So you see there in 2012, it's already 20 times a year people are going on and accessing something about their care. That we have anecdotal evidence that lots of times that does end up saving a visit or saving a phone call, and that's the sort of benefits you have to begin to look for. At least at the primary care level, it has not really reduced face-to-face visits yet. What we're seeing is less utilization of emergency departments, or I think you call them A&E or something, right? Reduction of that, reduction of hospitalizations, reduction of prescriptions. This was a study that actually we did a couple of years ago, and we saw a little, just pre and post the implementation of our IT system, we saw about a 5% reduction in both ED visits and hospitalizations. Again, remember I mentioned before, we haven't seen that same thing at the primary care level. It's been more this downstream work. This was probably one of the ones that we have been most excited about. This is where we took patients that had any sort of coronary event and actually enrolled them through registries, got PharmDs involved, and watched them prospectively over 3 years. And we saw this kind of reduction. You do need to get doctors out of the exam room. It's really to try to help doctors think about the community as their patient, as well as the patient in front of them, or the patient on the phone, or even the patient on the email. And that community is a patient. It has vital signs. It has metrics that you should be doctoring and taking care of. And so trying to expand the role that we utilize our doctors in, getting them, whether it's quality improvement, resource stewardship, what I mean by that, evaluating, helping us evaluate new technologies and new treatments on whether they're really effective, the implementation of IT, working alongside pharmacists actually to decide out of the 30 different ACE inhibitors that are potentially on a formulary, which 4 or 5 can you do bulk purchasing and meet all the clinical effectiveness, being involved in research, public policy, and product development, you can see. So anyway, I look forward to the conversation. Thank you for your time.